Okay. Where is the link? Attach link. Suresh, can you give me the mic? Good evening to all my wonderful sisters and brothers. Nice to see Muhammad Imran, Suma Ravireddy, and many more. I am Dr. Murli Bharadwaj, MD in General Medicine, a physician, and past 23 years, I made almost 2 lakh doctors to become toppers in PG medical entrance and to do their MD. So it is my privilege, by the grace of the God, Thanks to nutsnaukri.com, Muhammad Karimullah Sultan, who engaged me to teach and give coaching to do the revision of all the 14 subjects for the staff nurse recruitment exam. So medical and surgical nursing is 50% subject. Then you have fundamentals of nursing, obstetrical nursing, nursing management, anatomy, biochemistry, microbiology, pharmacology, etc., etc. Totally 14 subjects. Every day, I teach you around an hour or two. If you are from Hyderabad, please come and become my guest. You get coffee, you get cookies, you get samosa, everything, and we will wonderfully study. But if you are not there in Hyderabad, still be my guest every day, and we have an hour or two of revision. And I'll also give you 300 pages notes covering all the 14 subjects for the staff nurse recruitment exam, which is also useful for the Dubai Authority exam, NCLEX, hard, everything. So let's make the great beginning, sister. So am I audible, loud and clear? Can you please type into the chat window? So please let me know. Always let me know if I'm too speed, too fast. So totally 300 pages notes we need to revise and cover all the 14 subjects in nursing. And there are 10,000 MCQs that we are going to practice. Thank you, Suma, for giving a apt feedback. So let's make the great beginning. Inflammation. So what is inflammation? So whenever we get any infection, the body will fight against that infection. It will create a reaction against that infection. It will neutralize, it will control, it eliminates that offending agent and repairs. That is called inflammation. There are mainly 5 signs of inflammation. First of all, tell me, sister, what is meant by sign? What is meant by symptom? Symptom is what the patient tells. Doctor, I have fever. I have pain in my abdomen. I'm having headache. They're all symptoms. What patient tells you. Signs means what you see in the patient is called sign. You have seen that the patient is having swelling of feet, fetal edema. That is called clinical sign. Now, what are the 5 cardinal signs of inflammation? The inflamed area will be red. Inflamed area is warm. Inflamed area is swollen. Inflamed area is painful, and inflammation made a loss of function. So these are 5 are called cardinal signs of inflammation. Once more, sing along with me. What are the cardinal signs of inflammation? Redness, warmth, swelling, pain, loss of function. These are called the cardinal signs of inflammation. So what are the chemical mediators that lead to all this warmth, pain, etc.? So whenever inflammation happens, there are a type of cells called mast cells. What are they? Mast cells. They release histamine. Histamine leads to vasodilation. The blood vessel become dilated, and the blood vessel wall become leaky. There is an increased vascular permeability, so that all the fluid inside the blood vessel will leave the blood vessel, and that lead to the development of edema. So what is causing, why our limb is swollen when you get inflammation? Why the area becomes swollen? Why edema will develop? It is all because of the histamine. What is that substance, sister? Histamine is what you should remember. Then, the moment there is a robbery in the home, what will you do? You will call police. So, similarly, neutrophils are the police. They need to come to the site of inflammation and repair it. So, how is that possible? There are substances called kinins, bradykinin, bradykinin, etc. They are responsible to attract neutrophils. Then prostaglandins, they are responsible for increasing the permeability of this blood vessel. The wall of this blood vessel, permeability. What is meant by permeability? The movement of the fluid out of the cell or into the cell is called permeability of the wall. So there is an increased vascular permeability due to prostaglandins. Neutrophils are attracted because of the kinins, and vasodilation and vascular permeability are increased by histamine. These three are called chemical mediators of inflammation, is what you need to remember. So some of these chemical mediators of the inflammation, they come from the cell. Cell itself releases. Some are there in the plasma. So what are the cell-derived chemical mediators of inflammation? Either they are already formed in and staying inside the cell, ready to jump out of the cell the moment inflammation begins. Second are, they are created within the cell. Within the cell they are created. So preformed chemical mediators of inflammation, synthesized de novo. De novo means appadikappudu, then and there. Preparing is called de novo. Just like you can order a ready-made idli from the hotel, or you can freshly prepare idli in the home. Synthesized de novo. So these prostaglandins are there, no doctor? The sister? Prostaglandins are all formed from a precursor. That means there is a substance from which they are formed. That is called arachidonic acid. Arachidonic acid forms the prostaglandins. Then there is a factor called platelet activating factor. Whenever inflammation is there, all the platelets, what are platelets? Platelets will cause clotting. So platelet activating factor, nitrous oxide, and lot of reactive oxygen species. Oxygen radicals are there, no? They will attack the organisms, infective organisms. So reactive oxygen species, cytokines, they're all synthesized de novo. Whereas histamine, serotonin are the two chemical mediators of inflammation which are derived from the cell, is what you should remember. Then from the plasma, what will you get whenever inflammation is there? Complement system. There is a system called complement proteins. Complement proteins. Complement C3A, C3B, C5A, they are all called complement proteins. They are also, what will they do? Complement proteins. Complement proteins will give a phone call to neutrophils. Hey, come neutrophil. So they are chemotactic agents, complement proteins. So complement proteins are derived from plasma. Then factor 12, clotting factor 12 is activated, so that coagulation system get activated, so that in the area of inflammation, the blood clots. The blood clots. So this is the story of chemical mediators of inflammation. Once more, tell me, what are the 3 things for the tomorrow's nursing exam you are going to remember. You need to remember, very good. Muhammad, Shabana, Imran, Ravi Reddy, and many more who are all online. Every day हम मिलेंगे, हम साथ में पढ़ेंगे, और डे बाय डे हमारा नॉलेज लेवल्स बढ़ना चाहिए. एक दिन आएगा जब हम कामयाब होके बताएंगे दुनिया को, भाई मैंने सरकारी नौकरी I am able to get. That's what you need to do, sister. I will give you 300 pages notes. Just you read the 300 pages notes and listen these video lectures. I'll give you 10,000 question bank. Just practice the question bank. And I will also give you mock tests every day. At least after some syllabus is over, I'll keep giving you mock tests. Just you do that practice. Everything is available on the mobile app. I will give you activation on the mobile app. Automatically you will get. You want to go to America? Same knowledge is needed to crack NCLEX. You want to become a nurse in the AIMS? You want to get in railway nursing job? Or you want to take the hard and go to Dubai? Or you want to get the Telangana State Public Service Commission exam? For everything, this is the knowledge. 200 hours, stay with me, listen the classes, do the revision on the notes, and then you practice on the mobile app, right? And there are so many teachers you come across, some teachers who are nurses who teach you, but first time you are listening the whole coaching program of all the 14 nursing subjects by a doctor. Yes, because we are fundamentally very passionate teachers. We love to see you that you get the top rank and be able to clear your exams. So whenever you get time, come to Nampally. Be my guest. Coffee मिलेगा, समोसा मिलेगा, cookies मिलेगा, और हम मिलके बैठ के साथ में पढ़ेंगे. Right, sister? Now, the next thing is, what are the phases of inflammation? First phase is inflammatory response. First phase is inflammatory response, 3 to 5 days. During that time, there is a blood vessel constriction, vasoconstriction, followed by vasodilatation and an increased capillary permeability that lead to redness, swelling, and warmth. And because of this increased blood vessel permeability, the fluid inside the vessel will go out, and such a fluid is called exudate. What is exudate? Whenever there is inflammation, there is an increased vascular permeability, and the fluid inside the blood vessel will leave the blood vessel, and it forms edema, pleural effusion, pericardial effusion, etc., etc. That is called exudate. Other type is called transudate. What is the meaning of transudate? Suppose you are having an increased pressure inside the blood vessel. That also pushes the fluid out. But that fluid will not contain protein. It won't contain rich protein. And it is called transudate. Transudate. Another important point you need to know. The plasma is flowing inside the blood vessel. What is the factor that is preventing it from leaving the blood vessel? It is the amount of albumin, amount of protein which is inside the plasma is preventing the plasma to leave the blood vessel. So that is the reason if you have a nephrotic syndrome patient, you know nephrotic syndrome? They lose protein into the urine, so they don't have enough protein in the plasma. Such people also, plasma will leave the blood vessel. But once more, that is called transudate. So transudate is the fluid and edema formed by the leaving of the fluid from the blood vessel to outside the blood vessel, either because of low plasma protein or increased capillary pressure. The pressure inside the blood vessel, if it is high also, that lead to transudate. Whereas, what is exudate? Inflammation increases the permeability of the capillary from which the fluid leaves. Then that is called exudate. So exudate has plasma, rich in plasma proteins. Because it is due to inflammation, it will have white blood cells. They all will migrate. And when they migrate, they cause a pressure on the nerve ending. And that lead to pain and loss of function is what you need to remember. Once more, quick feedback. Shabana, Imran, Suma, please give me an answer. In the middle, I'll keep asking you questions to know whether you are sleepy or are you awake. Okay? You don't mind me asking questions. Now tell me. What is the inflammatory mediator? Inflammatory mediator which increases the vascular permeability. Just now we discussed chemical mediators now. Which is that inflammatory mediator that increases vascular permeability? Punch your answers into the chat window, sister. Come on. So if you come to the class, we'll be very interactive. There is online is always online, but it's okay, right? So sometime also take a chance to come to the center. We have a beautiful center in Nampally. Almost 200 students can sit here. So please do come. And now give me the answer. What is that chemical mediator which increases the vascular permeability? Come on, sister. Come on, brother. Who is going to give me the answer? Just now we discussed various chemical mediators, right? Yeah. So give me the answer. Meanwhile, I'll be continuing. Good to see 9 online classmates. So now you need to remember that WBCs, plasma proteins, they all are the part of exudate. And leukocytes, what will they do? They eat the organism. They kill and eat the organism. And they remove all that cellular debris. It is the macrophages which lead to phagocytosis. That is what you need to remember. So that is all the phase 1 of inflammation. So what is the next phase? Phase 2. Phase 2 is repair and regeneration. It occurs between 2 to 8 weeks. And there is a new collagen that will be forming. Collagen is what? That structural protein. ఇప్పుడు టీబీది టీకా వేస్తారు కదా, బీసీజీ టీకా వేస్తే అక్కడ మీకు ఒకటి టీకా పడుతుంది కదా, స్కార్. That scar is all collagen. The collagen is all that scar. So new collagen is formed during the repair and regeneration. They're all laid down in a very disorganized manner, and that will form a scar. And this new tissue can easily break also in the phase 2. Then phase 3, what will happen? All this scar tissue will undergo remodeling. Then it will become strong. And it become organized. And it become a strong scar. That is the third phase of inflammation. So, once more, summarize, sister. Inflammation, whenever it occurs, there is a early phase, late phase. Early phase, neutrophils, late phase, macrophages. You have a proliferative phase and remodeling phase. In the proliferative phase, which occurs between 3 to 10 days, there is a reepithelialization. Angiogenesis means blood vessels form. And granulation tissue forms. Fibroblasts undergo migration. Fibrin and collagen get deposited. Then there is a remodeling. During remodeling, there is cells will start shedding. That is called 21 days post-injury. So now, sister, I'm very happy to see 9 online classmates. Tell all your friends that you bring more friends, you bring more friends, you bring friends to the class directly. As a teacher, I get inspiration to teach you more, right? So don't worry about money. Whatever money you love to pay, please pay, no problem. After all, being a doctor, being a physician, it is our responsibility, social responsibility to train, teach, and make knowledgeable sisters and brothers who will improve the care quality. That's the reason you're not only reading just for the sake of clearing the exams. Always you are also becoming knowledgeable, sister. Be very sure about it. If you all come, I will teach you ECG. 3 hours, you know everything about ECG. You know how to read a ECG. All of you come, but at least 100 sisters, if you all, and brothers, if you all come, I will teach ECG. Probably tomorrow when you go to hospital, you tell, doctor, I think this is a case of ventricular fibrillation, this is antrovesicular block. Your doctors will feel, oh my God, where did you learn? You tell, Dr. Murli Bharadwaj, 3 hours taught everything about ECG. ECG is nothing. No brains needed for that. If you know your right hand is on right side, left hand is on left side, you know how to interpret a ECG system. So now, exudate. When the fluid is involved in the inflammatory edema, it is known as exudate. How many types of exudate that you know, sister? Serous exudate, fibrinous exudate, purulent exudate, hemorrhagic exudate. Hemorrhagic means there is a blood in that exudate. Purulent means there is a pus in that exudate, and lot of macrophage, dead neutrophils, everything are there. Then serous exudate, which is water-like exudate, if there is a minor injury. And these are all the types of exudate. So what is this, sister? This is the typical granulation tissue that forms when there is an inflammation. There is a granulation tissue which is being formed. And what is this? This is all called fibrinous exudate, where in the exudate you have a lot of inflammatory cells, small, all these blue dots are there, no? They're all called inflammatory cells, fibrinous exudate. Then this is a yellow gelatinous exudate, and you can see all these typically form thrombi in the blood vessel. Whenever patient is having sepsis, a lot of sepsis is there, then that lead to the typical formation of the fibrin thrombi inside the blood vessels is what you need to remember. Now I will tell you 23 high-yield facts which are sure to come in nursing exams. Let us quickly run through them. Nociception. What is the meaning of nociception? Always remember, noci means pain. Noci means pain. Feeling the pain is nociception. Nociception is a physiological process wherein the tissue damage is informed to central nervous system. What is central nervous system? Brain, spinal cord. They're all part of CNS, central nervous system. Cerebellum, they're all part of central nervous system. Whereas the nerves that come from the spinal cord, that constitute peripheral nervous system. Okay? So whenever you are having any pain, that tissue damage, immediately it will be informed to the brain, central nervous system. That's called nociception. And who increases that pain sensitivity of the free nerve endings whenever you have inflammation? It is the prostaglandins and bradykinin, they both. Then there are obviously God created some things which make our life a little easier. What did the God create? Typically, God created endorphins. What do they do? Endorphins are produced inside our own body. In our body, there are receptors called opiate receptors. Opium is, no? Opium. So, opiate receptors. Endorphins are produced in our body. They go and act on opiate receptors and make all the pain not to go to brain. So that is the reason perception of the pain is reduced when the endorphins produced at the time of any inflammation interact with the opiate receptors is what you should remember. Similarly, morphine, codeine, all these drugs which are used, how they are painkillers, sister? It is because they, just like endorphins, act on opiate receptors. Then what is meant by dehiscence? Dehiscence. What is the meaning of dehiscence? Dehiscence means separation and disruption of the wound edge is called dehiscence. Then what is importance of hyperbaric oxygen? With very high pressure, give oxygen therapy. That is delivery of oxygen with at increased atmospheric pressure. So basically, if you give hyperbaric oxygen whenever there is inflammation, because in nursing, what is the main job, sister? Good to see Sheikh Samreen, Shahida Begum, Muhammad Shabana, Muhammad Imran. Wow, that is wonderful. So, आप सबको मैं एक न एक दिन हमारे नामपल्ली सेंटर में देखना चाहता हूं. शेख समरीन, शहीदा बेगम, शबाना, and everybody. You are in Mehdipatnam, I am in Nampally, just adjacent. Please come. We will get a nice Charminar chai with nice biscuits, and then we will have a discussion. See, without students in the live class delivering to online students within 1 hour, you get a breakdown. Whereas you have students before 4 or 5 hours also, teaching is effortlessly we can teach. That's the reason we had been asking the students, please come to the class if you are from Nampally. Please let me know in the WhatsApp group what is the best time that will help you to come. Right? We only have another 3 months time. In this last 3-4 months, we need to study more longer. Right? Good. Nice, Imran. Please do come to the class. So, continuing our discussion, hyperbaric oxygen therapy accelerates granulation tissue and help in wound healing. So now, one of the favorite questions of examiner. What is the main type of leukocyte, WBC? In WBCs, you have different types, na, sister. One is called eosinophil, neutrophil, monocyte, macrophage, basophil. Come on, once more tell along with me. Eosinophil, neutrophil, monocyte, macrophage, basophil. Out of all these, which is the most important WBC? Which responds at the time of inflammation? Neutrophil. And what is the meaning of left shift? A lot of pathologists will be talking left shift. What is the meaning of it? So fundamentally, when the neutrophil is formed, it starts as myeloblast in the bone marrow. It becomes promyelocyte. Myelo means WBC, white blood cell. It becomes myelocyte, metamyelocyte, then it becomes band form, then it becomes segmented neutrophil, ultimately mature neutrophil. So in the peripheral smear, when you look into microscope of the patient's blood smear, you see neutrophils, mature neutrophil. But whenever there is inflammation, acute infection is there, then bone marrow is quickly producing the neutrophils. That is the reason there is no time for the bone marrow to produce a mature neutrophil. Instead, it will produce an immature white blood cell, like myeloblast. That is called left shift is what you need to remember. So this is the bone marrow, myeloblast, promyelocyte, neutrophilic myelocyte, metamyelocyte, band neutrophil, mature neutrophil. So whenever infection is there, lot of myeloblasts, promyelocytes, all these cells will start appearing in the blood smear, which is called left shift is what you need to remember. Now, good to see Haimavati Reddy. Very good, Haimavati. Please come to our Nampalli class. And in Hyderabad, we'll be very happy to receive you. So, sister, what happens in neutropenia? Suppose, no, sister, all of us will give chemotherapy to cancer patients. Chemotherapy to cancer patients. What will this chemotherapy agents will do? They will go to the bone marrow, they suppress the bone marrow, so that the neutrophil production in the bone marrow decreases. And that is called neutropenia. If the neutrophils are not there, we don't have protection against bacterial infections, especially infections like Pseudomonas. They all will increase whenever the patient develops neutropenia. So decreased inflammatory response with decreased neutrophils is called neutropenia. Then what is meant by opsonization? What is meant by opsonization? Please remember, this important terminology is very important. Examiner will ask very simple questions. Okay, sister, what is meant by opsonin? आप इडली खाना चाहते हो, इडली खाली इडली के जैसे खाए तो मजा नहीं है ना. इडली में क्या डालना पड़ता? कोकोनट चटनी, टमाटो चटनी. चटनी डाले तो इडली टेस्टी बनेगा. तो ये चटनी जो होता है इडली को टेस्टी बनाता है, इस चटनी को बोलते हैं opsonin. So whenever the bacteria comes, a neutrophil macrophage want to eat, it is like a bland plain idli. अगर सांबर डालो, चटनी डालो और इडली गर्मा गर्म अच्छा दिखेगा खाने के लिए, तो तब क्या बोलेंगे आप? ए टेस्टी बनाने वाले चीजों को क्या बोलते? Opsonization is the term that you need to remember. So phagocytosis, that is macrophage eating the organism, is phagocytosis. Typically occur when you make the foreign molecule more recognizable by the macrophages, is called opsonization. Then whenever you have a TB patient, what will you say? Hey, how is the ESR? Typically ESR is high. Erythrocyte sedimentation rate is high. So increased ESR is an indicator of inflammation. Now once more tell me, how many types of WBCs that you know? White blood cells? Come on, sing along with me. Neutrophil, eosinophil, basophil, lymphocytes. So out of all these, which cell will increase if you get a parasitic infection like amoebiasis? In all the nursing hostel, you eat the hostel food, what do you get? Amoebiasis. When amoebiasis like infections, amoebiasis is an example of a helminthic, is a parasitic infection. Similarly, you will get various worms, round worm, ring worm, etc. All these are called helminthic worms. They all lead to eosinophilia. So you should remember, whenever there is any allergic reaction, parasitic reaction, cancer, then eosinophil response will increase. Then whenever inflammation is there, what is in the first 24 hours, what increase? Neutrophils. Then during 24 to 48 hours, what type of cells increase? Macrophages. Macrophages become dominant in 24 to 48 hours. So these are all individual favorite क्वेश्चन सिस्टर. आज हम बहुत खुश हैं. 11 online students. So you're all in WhatsApp groups of your classmates, and also you are working in hospitals. Tell everybody, once in a lifetime 5,000 posts are declared by Telangana government. That is because elections are coming. So what you need to do, sister, tell all your friends, hey, only 1,999 rupees, 2,000 rupees only. In addition, I'll also give 300 pages notes to you. Everything I'll give you. You tell all your sisters to come, because Dr. Murli Bharadwaj, MD General Medicine from Nizam's Institute of Medical Sciences, is sitting here to hold your hand, make you to do revision and become the topper in the tomorrow's staff nurse recruiting exam. Will you tell? Because we don't advertise. Our students themselves are our brand ambassadors who will make everybody to come and join us, right? So that is the promise we shall have. Tomorrow, this 11 students here should become 100 students attending the class. Be part of the WhatsApp study group. And before starting the class, I will send you the link. After the class is over, we will make this video available in our mobile app. It's called Score Nurse Naukri app. It's called Score Nurse Naukri app. 2-3 days, app will be up. We will make it available for you. All right? Good. Now, sister, increased capillary permeability and blood flow to the site of injury. They are the things in inflammatory response. How is the granulation tissue? What is the color of granulation tissue? Fresh granulation tissue, sister, pink or red in color. But if that granulation tissue is very dark in color, it is a sign of a poor blood flow. Perfusion means blood flow. Some terminology, you need to catch up the English with me, sister. I can even teach in Telugu, but I have students in Gujarat, I have students in Kerala. That's the reason I don't want to use Telugu. Telugu is easy. But all of you are brilliant sisters who studied in your school, very good English. I speak a lot of good English, sisters. So that's the reason I hope my English is not complicated, right? So perfusion means blood flow. So dark granulation tissue is a sign of poor perfusion. It is a sign of infection. That's the reason you always need to look during the ward rounds. How is the granulation tissue of the patient? Is it pink or red? Very good. Dark granulation, poor perfusion, not good. That is what you need to understand. And always change the position of the patient every 2 hours. If at all, if you say, what is the best method? What is the best method for preventing the pressure ulcers, decubitus ulcers in a bedridden patient? Change the position, left, right, every 2 hours. If you do know, you will prevent grandpa from developing bed sores, pressure ulcers, decubitus ulcers is what you should remember. Now, there is a scale called Norton scale, Braden scale, to know what is the chance that a person, bedridden person, will develop the pressure ulcer. What is the name of the scale, sister? Norton scale, Braden scale. It's only Waterloo scale. It is also used to assess the pressure ulcer. So, what is gangrene? Gangrene means it is the tissue death because of the lack of the blood supply and oxygen. Dry gangrene mostly affects the limbs. Moist gangrene, wet gangrene it is called. It affects the bowel. Our gut is moist gangrene. Dry gangrene is the limbs, and gangrene is because of the lack of blood supply and oxygen. Now let us look at each of them. So what is Braden's risk assessment scale, sister? Lot of times this question came in RRB nursing exam, and many exams. Sensory and mental status, how is it? Moisture of that wound. How is the activity of the patient? Is he bedridden, chair ridden? He is able to walk with assistance, without assistance. Similarly, mobility, is he 100% immobile, very limited, slightly limited, full mobility is there? Nutrition, very poor or eats everything, or friction, is the frequent sliding is there, etc. So based on this, you can make a assessment. What is the chance of developing a decubitus ulcer is what you need to remember. So there is a scoring system. If the scoring is 19 to 23, higher the score, better. If the scoring, the Braden scale, wound assessment scaling, nursing scaling, as a nurse, you need to evaluate. How is he? Is a mobile patient? Is there any moisture in that area of the wound? Is he totally bedridden? For example, if he's completely paralytic, like spinal cord injury patients, neurosurgical patients, if they're completely immobile, there is a greater chance of developing the bed sores. So similarly, Norton scale, this also uses physical condition of patient, mental condition, activity, mobility. If he is having incontinence, that is also important. What is meant by incontinence? Incontinence means normally bladder passes urine through urethra. So normally there is a sphincter, urethral sphincter, which prevent the urine from coming out. If that sphincter is weak, then the urine will come out. That is called incontinence. So is there any incontinence? So these are the things you need to assess. Wound assessment is called Norton scale. Then what is Waterloo scale of wound assessment? You will always look what is the weight and size. Is he obese person? What is the skin type? Some elderly grandma, नानी माँ दादी माँ का कभी कभी स्किन बहुत पतला होता है. जो पतला होता है उसको बहुत जल्दी आसानी से decubitus ulcer हो जाएगा. So that is what you need to remember. How is the skin type? How is the mobility? How is the continence? How is the male, female, appetite, tissue malnutrition, neurological deficit, surgery? What type of surgery? Is it an orthopedic surgery? How long after surgery patient is? What type of medicines he is taking, like steroids? If he is taking steroids, that will make the skin become very fragile, and there is a greater chance of wound injury. So all these things are included under water load. So tell me how many scales you know to assess the wounds as a nurse. Braden risk assessment, Norton scale, Waterloo scale is what you need to remember. So now, sister, let's talk about the lymphatic system. Lymphatic is the main part of our immune system, which contain lymphatic vessels. Lymphatic vessels carry a very clear fluid. And what does lymph contain, sister? What is lymph? Lymph has lymphocytes, other WBCs, waste products like urea, creatinine, and debris. So whenever it is like all kachra will be passing to that septic tank tube, no? That is lymphatic system. And in a lymph node, a group of lymphocytes are seen. Similarly, the spleen on the left side, thymus gland in the neck, they're all called lymphoid organs. What is meant by immunity? Immunity is the ability of the body to fight against an infectious agent and foreign material. So how many types of immunity are there, sister? Innate immunity, acquired immunity. Acquired immunity is also called adaptive immunity. अच्छा भाई, innate immunity क्या होता है? एडाप्टिव इम्यूनिटी क्या होता है? जब हम मां के पेट से बाहर निकलेंगे ना, तो जब हम पैदा होते हैं, अम्मी जान हमको जरा इम्यूनिटी देता है, ब्रेस्ट फीडिंग से इम्यूनिटी मिलता है। वो सारे इम्यूनिटी होता है जो पैदाइश से होता है। भाई, व्हेन यू आर बॉर्न, द इम्यूनिटी यू हैव इज कॉल्ड innate immunity. Other is adaptive. Whenever you get any infection, right, then you develop immunity. Like once corona vaccine you took, you got immunity. Corona infection first time you got some immunity. That is adaptive. So quickly tell what are the differences. Passive immunity comes from mama. Then active infection will give rise to adaptive immunity. Then the mummy gives immunity to us by the transfer of antibodies, mother's antibodies, immunoglobulins. What are the antibodies? Immunoglobulins are called antibodies. Mummy's immunoglobulins come to the baby, to the fetus. That is called passive immunity. So that is what you need to remember. So once more, there are 10-15 differences between innate and adaptive immunity. So remember, sister, all these PowerPoints, they're all made available in the Score Nurse Naukri app. So what are the cells involved in innate immunity? Leukocytes, natural killer cells, mast cells, granulocytes, basophils there. Whereas adaptive immunity that you get whenever you get infection, it is that T lymphocytes, B lymphocytes, antigen presenting cells. T lymphocytes, B lymphocytes, antigen presenting cells. These constitute the adaptive immunity. Antibodies are involved in adaptive immunity. Then immediate immunity is immunoglobulin given by mother will give you immediate immunity. Whereas adaptive immunity, if you take a vaccine, it has to go and activate your lymphoid organs. It need to create immunological memory. Then only you will get immunity. Today you took BCG means tomorrow you are not protected. It takes some time for the BCG vaccine to become active. That's the reason adaptive immunity will take over days to weeks. Whereas whatever you get from mummy, that is immediate. So the first line of defense of the immune system is always innate, what you have. And so these are the things. But whatever the antibodies that you got from the mother, your immune system don't know how to manufacture it. It doesn't have any memory. It came from mother and it saved you. But whatever you give vaccine and give adaptive immunity, or infection you get and you got immunity, that will create a immunological memory. Even after infection is gone, the patient will have for a long time a memory about how to attack that infection. So it is a immunological memory which is there in the adaptive immunity is what you need to remember. So in the innate immune system, it is activated immediately after the exposure of antigen, but it is not specific. It is not specific to this mycobacterium or this leprosy or this TB. Like that, it is not very specific, the innate immunity. I'm telling you 5 points about innate immunity, 5 points about adaptive immunity that you need to remember. Once more, this is going to be the favorite question of the examiner. So all these things you need to keep practicing, sister. Then only first time anything looks new. You might have done a lot of emergency night duties. You might have seen so many snake bites, organophosphor poisonings, heart attacks, bronchial asthmas, everything during your career. First time, पूरा दुनिया अजीब लगता है, अजनबी लगता है. बाद में वो पहचानित हो जाता है. सो पढ़ाई भी वैसा है. पहली मर्तबा ऐसा दिखेगा कि अरे भाई ये क्या है, बहुत a lot of information package, but slowly second martabe mein aap you become expert. So that's the reason I'll give you notes. All these things are there in the printed notes I give you. 300 pages notes, sister. But if you master the 300 pages of these notes, any exam, RRB, hard, NCLEX, to America, nahi to Australian nursing exam, Canadian nursing exam, Telangana state staff nursing exam, anything, you will become champion of champions. Take it as my word. So, sister, innate immunity, number one, immediately after exposure of antigen, you get that. It is non-specific time. And innate immunity is typically provided by your saliva, tears. Then in the stomach, you have hydrochloric acid. Then there is a normal flora in the body secretions. They all contribute for you to have the innate immunity. And typically, phagocytic cells, natural killer cells, there are a type of cells called NK cells. What is that, sister? NK cells. What is the specialty of NK cells? If you look at immunity, there are two types of immunity system. Please remember. Right in our 9th class, 10th class biology only, we studied all that. One, it is called cell-mediated immunity. Second type, humoral immunity. Humoral means a immunity that you get with antibodies is called humoral antibodies. Cell-mediated means lymphocytes, macrophages. All this is called cell-mediated immunity. Humoral means antibody से आने वाला immunity को humoral immunity बोलते. You'll remember, right? So what lead to humoral immunity? Humoral immunity is antibodies. How are antibodies produced? Who produce antibodies? Plasma cells. Plasma cells produce antibodies. Who produce plasma cells? B lymphocytes become plasma cells. Plasma cells produce the antibodies. This is what you need to remember, sister. B lymphocytes produce plasma cells produce antibodies. Antibody associated immunity is humoral immunity, whereas T lymphocytes, macrophages, basophils, that is all what? Cell-mediated immunity. Then there is a type of cell called NK cell. NK cell. What is NK cell? Natural killer cell. So, just like T lymphocytes, natural killer cell can cause cell-mediated immunity. Same time, just like plasma cells that produce antibodies, it is capable of even producing antibodies. Both the things it knows. That is called NK cell. So what is NK cell? Why do we need NK cells? What is the main function of NK cells, sister? NK cells help us to fight against viral infections. NK cells will help us to fight against cancer. So anti-cancer is NK cells, viral infections is NK cells is what you have to remember. So that is the story of natural killer cells. So with this, we will call it a day, sister. I hope you all enjoyed the second class. First class already is there on the YouTube. You can review that. Second class. Also, you are in WhatsApp group. Whenever I get time, in the morning or any time, I will quickly launch from my home a half an hour, 1 hour class, and then we will, because our time is very short, only 4 months time is there, means we need to do quick revision, right? So 3-4 months time only is there. So whenever I get time, I launch a YouTube session and invite you in the WhatsApp study group. Please be part of that. And हम रोज पढ़ेंगे और जरा बेटर बनेंगे और पेशेंट्स को भी बेटर सर्व कर सकते हैं. So totally, sister, there are about 120 medicines, drugs. Each medicine, what is the mechanism of action? What are the side effects? Before you give, what are the precautions to be taken? Each medicine you should master, right? How asthma drugs occur, function, how BP tablets function, how diabetic tablets function, what are the types of insulin, everything we will master. Thank you very much for coming, and let us study every day. Good night.